Thank you, Mr. Chairman. And I want to thank the witnesses for being here with us today and presenting the information. This hearing is really extremely important, and I appreciate your expertise. You know, I, like one of my earlier callers, believe that when those that voted for the Affordable Care Act, they sincerely believed they were helping. Let's face it, I'm sure that was their thought process when they voted for it. But it's disingenuous today to ignore the fact that there are problems. Unfortunately, since the passage, the Affordable Care Act, the access to affordable care has significantly dropped. There's no denying that since the ACA premiums are rising, deductibles are rising, and many people can no longer afford their health care plans. And we're hearing that proposed rate filings for 2017 on the federal marketplace are projected to increase a median of 19%. I go back in my district and I have meetings with employees. Every time I meet with an employer, I want to meet with the employees. I ask the same question. Are you happy with the Affordable Care Act? Are costs okay? How are things going? I'm going to have to bring some of my colleagues from the other side with me because I get very few people put up their hand and say they like it. Now, some people do. I'm not going to lie and say it's not 100%, but it's a very, very small portion of the people in the crowd. And I'm talking about hundreds and hundreds of people. So I always ask them a question. Tell me what the issues are. Tell me what the problems are. I try and learn from it. Look, no law passed is going to be 100% perfect. But I go back to my colleague last year, John Carney. He tried to pass H.R. 4414, which was a fix to the Affordable Care Act, and we got that passed. The sad thing that was the majority of Democrats, over 133 Democrats, even came to the floor and said, we can't change anything because if we change it, we're going to open up the doors to changing more things. So 133 people even voted against a simple change, ignoring the fact that there are problems. And those are the things we have to fix. Just last month, in my home state of Ohio, we had the 13th co-op, InHealth Mutual, announced it was going out of business. It was one of 23 co-ops created under the ACA, had received $129 million in taxpayer funds, had left nearly 22,000 Ohioans with fewer choices, and unfortunately, once again, searching for new health insurance. So again, we know there's problems out there. We can say we can talk about how great the Affordable Care Act, it has problems. And we have to start looking at those problems. I've had people in my district, Brian from Westlake, saying he's lost his choices. I have another constituent, Scott from Dalton, saying his plan jumped from $314 in 2013 to $920 in 2016. He simply couldn't afford to continue with this plan and had to go to a higher deductible. I had another individual, John, a registered Democrat from Brewster, who said he now calls the ACA the Unaffordable Care Act. So these are real people, real lives, real things affected. But the saddest story I ever had was a woman walking up to me at a restaurant saying, Congressman, I've just had my hours reduced to 29 hours, and now my premiums are going up and I have a deductible I can't afford. Help me. That was the saddest moment when it came to the Affordable Care Act. Help me. And that's what we need to do. So I want to talk a little bit about this deductible, because we've talked about premiums. Nobody can argue that premiums are going up. They're going up. Everybody knows that. They're going to go up again this year. But we're getting people insurance, and I have an individual in my district who has fully subsidized insurance, but came to me and said, Congressman, thank you for allowing me to get insurance. I said, well, I wasn't part of the vote for the Affordable Care Act, but she says, I can't use it anyway because I have a $6,000 deductible that I now can't use. The insurance is worthless for me. I need surgery and I can't get it done because I can't afford that. Mr. White, can you talk a little bit about the deductibility, how this deductibility is affecting people and the size of it and how that hurts people getting health insurance?
It's massive, and it's not just the deductibles. So the deductibles are increasing on average by about 20%, or they increased 20% this year. So the average silver plan has about a $3,000 deductible. Average bronze plan is about a $6,000 deductible, but $10,000, $12,000 deductibles are not uncommon. And the reason these deductibles are that at that level is that it allows the insurer to lower the price point, the premium rate that they sell on the exchange. And a lot of consumers will shop for a plan based on the premium, not necessarily the deductible.
So you would agree that because of the Affordable Care Act and because premiums are going up, the only way to reduce the premiums is to raise the deductible, which in the end, who pays? The American people.
Consumer, absolutely. And it's not good because, as you indicated, when you have these massive deductibles, you're not accessing care. So you're not getting maybe the diabetes care, the coach management, the preventive care, the well baby care, the things that you really need to stay out of hospital, out of expensive settings. It's unsustainable over the long term.
Thank you, Mr. Chairman. I yield back.